Hello everyone, myself Tasmia. Today we are going to discuss about the pectoral region. So before going to the pectoral region, we must know that muscles of the upper limb are found in pectoral region, shoulder, upper arm, forearm and hand. Now let us discuss the first pectoral region. It is on the anterior chest wall. It consists of four muscles: pectoralis major, pectoralis minor, serratus anterior, subclavius. Now let us discuss the first muscle, pectoralis major, which is the most superficial muscle of the pectoral region. It originates from the medial two-third of the clavicle, second and sixth costal cartilage, aponeurosis of the external oblique muscles of abdomen. And these muscles get inserted into the lateral rib of the bicipital groove of the humerus, which is present in the shoulder. The nerve supply to this pectoralis major muscle is medial and lateral pectoral nerve. The major action of this pectoralis major muscle is it helps in the adduction and medial rotation of the shoulder joint.
So now, as you can see in the diagram, the pectoralis major muscle is getting originated from the medial two-third of the clavicle, second to sixth costal cartilage, and the aponeurosis of the external oblique muscle of the abdomen, and getting inserted into the lateral lip of the bicipital groove of the humerus bone.
Now let us discuss about the pectoralis minor muscle. It is the second superficial muscle after removing the pectoralis major muscle. It gets originate from the third, fourth, fifth ribs and gets inserted into the medial border of the coracoid process of the scapula. The nerve supply to this pectoralis minor muscle is medial and lateral pectoral nerve. The major action of this pectoralis minor muscle is draws the scapula forward and depresses the shoulder point.
So, as you can see in the diagram, the pectoralis minor muscle is getting originate from the third, fourth, fifth rib and gets inserted into the medial border of the coracoid process of the scapula.
Now let us discuss about the serratus anterior muscle. The serratus anterior muscle is also known as boxer's muscle, also known as swimmer's muscle, because it helps in boxing and also in the swimming. It gets originated from the upper 8 ribs of the mid-axillary plane and gets inserted into the costal surface of scapula at its medial border. The nerve supply to the serratus anterior muscle is it is supplied from the branch of the brachial plexus. The major action of the serratus anterior muscle is it pulls the scapula forward.
So now, as you can see in the diagram, the serratus anterior muscle is getting originated from the upper 8 ribs of the mid-axillary plane and getting inserted into the costal surface of the scapula at its medial border.
Now let us discuss about the subclavius muscle. Subclavius muscle it originates from the first rib of the costochondral junction and gets inserted into the subclavian groove of the clavicle. The nerve supply to this muscle is subclavius nerve, and the major action of this muscle is serve the clavicle in the actions like downward and forward.
As you can see in the diagram, the subclavius muscle is getting originated from the first rib of the costochondral junction and getting inserted into the subclavian groove of the clavicle. Now let us discuss about the clinical anatomy of the pectoral region. The first one is Poland syndrome. It is a birth defect or a congenital disease characterized by the underdevelopment of the pectoralis major muscle. In some cases, there may be also short ribs, less fat, breast, and nipple on same side of the defect, as you can see in the diagram. But typically, the right side is involved more. Thank you.